Hello, I'm Dr. Marielena Alvarez, and today I will talk about otitis externa, which is inflammation of the external ear canal, and is among the 10 most common reasons for pets to require veterinary attention. I will talk about the clinical signs pets show, about the causes of otitis externa, how to clean your dog's ears and your cat's ears, and how to administer medication to their ears. Well, why do these problems occur? There are causes that start the problem, and there are causes that perpetuate the problem. Ear mites and allergies would be primary causes. They initiate the inflammation, while bacteria and yeast would be perpetuating causes that make the problem go on and on. It is important in the treatment of otitis externa to address the underlying problem. Otherwise, the patient will improve, but the problem will recur. And this is why in dogs, 50 to 60% of the time, otitis externa becomes a recurrent problem. The clinical signs of otitis externa are classical, and they can include any of the following: scratching the ears, shaking the head, redness in the ear canal, discharge from the ear canal, a foul odor from the ear canal, or pain. This condition can be extremely painful, and sometimes it is better for the veterinarian to sedate or anesthetize the patient, and that would allow the veterinarian to better examine the ears, better clean the ears, and better medicate the ears. Here we have Lily, and she has been showing signs of an ear infection. She has been scratching her ears and shaking her head. The first thing that we should do after examining the ears with an otoscope is obtain samples. We're going to obtain a sample for cytology, and we're going to obtain a sample, not always, but many times, for a culture and sensitivity. For cytology, we'll take a cotton-tipped applicator, and we're going to get a sample from each ear. The applicator will be rolled onto a slide. Next, you'll fix the specimen with heat. And then we're going to stain the slide with these dyes. We'll rinse it. Allow it to dry. And then we're going to view it with the microscope to look for bacteria and to look for yeast. It takes 20 minutes to get the results to the cytology. When we do a culture and sensitivity, we're going to use a culturette. And we're going to take a sample straight from inside the ear canal. So we'll pick up the ear and get the sample. We're making sure not to touch anything else. This will go to the lab. And what they're going to determine is specifically which microorganisms are present in this infection and what are the best antimicrobial medications to treat this infection. It takes a few days to get the results to the culture and sensitivity. Next, we're going to clean the ears, and we're going to use a solution that has been specifically formulated to clean ears. It's important not to use alcohol, hydrogen peroxide, water, or soap. What you want to do is insert the nozzle of the bottle into the entrance of the ear canal, and you're going to squirt a little bit of the ear cleaning solution in one ear and then in the other ear. Then let the patient shake her head so that the material that's in there loosens up. And be careful not to be in the way, because sometimes when they shake their head, stuff can fly out of their ears. Then you're going to wipe away whatever material you see, and you can use cotton tip applicators to wipe away what you see. But if you're afraid that you're going to go in too deep, that's fine. Instead of using the cotton tip applicators, just use cotton balls, and you can clean the ear that way and go in as far as your finger goes, and that's not going to be too deep. It's important to clean the ears because if there is purulent material or debris inside the ear, it's going to decrease the efficacy of the treatment. Once we have the results on the cytology, which we obtain fairly quickly, we're going to determine what topical medication or systemic medication we're going to use. In the case of topical medication, it can be done in the hospital or it can be sent home with the owner to do at home daily. The way that it is administered is you're going to pick up the ear flap, you're going to put the nozzle of the tube into the entrance of the ear canal, and you're going to deliver the volume recommended by your veterinarian. You'll do the same thing to the other ear, and then you're going to massage the base of the ear canals for about 10 to 15 seconds. It's important that even if the patient stops showing signs of ear infection, that you complete the treatment that has been recommended by your veterinarian. When we we get the results on the culture and sensitivity, which can take several days, we might decide to maintain the current treatment, we might add a medication, or we might switch the medication altogether. We can't forget that when we're treating ear infections, not only are we going to treat the secondary causes such as the bacteria and the yeast, but we must also treat the underlying cause. For example, let's say that allergies are the underlying cause, which most of the time allergies are the underlying cause. If we don't get the allergies under control, the ear infection will improve temporarily, but the problem will recur. Okay, that's it for ear infections for today. I'm Dr. Medellina Alvarez. If you have any questions, please feel free to call our clinic. Have a good day. Thank you.